Hello, my name is Professor Clevert. I am the head of the Interdisciplinary Ultrasound Center at the University of Munich, Großhadern, Germany. Today I would like to share some of the latest cases by using the Samsung RS80 equipment and especially focusing on contrast enhanced ultrasound. The first case I would like to share with you is a patient who is known of breast cancer, and in the incidental examination they find a small tiny liver lesion, and we've seen it here in the grayscale. So the question is this a liver mets or just a benign liver lesion? So we have to use contrast enhanced ultrasound in order to rule out this pathology. By using the contrast enhanced ultrasound setting, we see that this nodule show a perinodal enhancement and a complete filling over time and no washout in the late phase. So the final diagnosis was just a hemangioma and no liver mets, so no treatment necessary. So the second patient is a patient who had got a bicycle accident. He fell on the right kidney and afterwards he had got pain on the right kidney. In order to rule out any trauma of the right kidney, we do an examination by ultrasound of the right kidney and we see a normal shape of the kidney. The question is there still any trauma, any subcapsular hematoma? In order to rule out this, we have to inject contrast enhanced ultrasound. By using the contrast setting, we see that most of the kidney is complete, filled with contrast, but in the center here, there's a laceration just in the middle of the center, so this patient suffers from a laceration of the right kidney and he have to be in hospital for follow-up examination. My final case of today will be a case of a small part. So we look at this testis and we see that the patient suffers from a couple of hypergenic lesions in the testis. In order to rule out whether these small lesions show any vascularization, we're using the high frequency power Doppler, and we see that this tumor also has some microvessels. Now we would like to see what about microperfusion of this tumor. Therefore we have to have the contrast settings, and we show that this tumor has got a high perfusion in comparison to the surrounding tissue. The final diagnosis of this tumor was proven under surgery, and it was Leydig cell tumor of the testis. In conclusion, the technique of contrast enhanced ultrasound provides additional information by using the Samsung RS80 equipment. This technique is not available on grayscale, so due to the help of new technique we could rule out pathologies, especially in oncology diseases. Thank you for your attention.